Hi Team Rerun, Physio Megan here. Today I'm going to talk a little bit about plantar fasciitis. I have done some videos previously on plantar fasciitis that will give a little bit more detail than I might talk about in this video. So have a little search through and look at them. But I'm just going to give a bit of a recap. And I'm going to talk a little bit about plantar fasciitis if you've had it for quite a long time. So the plantar fascia is a thick piece of connective tissue, and it originates from the inside of your heel bone and goes all the way to your big toe. And the role of it is to act as a support to the arch and a shock absorber. So if that was your foot, this was your heel. When you land on the ground, it stretches and then helps to propel you forward. Similarly, if you're running and you do a forefoot strike, it will stretch and absorb some of that load from the ground when you're running. It's a really common running injury and accounts for about 10% of running related injuries. Some people will be able to take a little bit of time off training, maybe do a little bit of, take some painkillers, bit of self-massage, stretch it out a little bit, and it completely resolves. For other people, it can be really debilitating and it can last for months and months. Now, my top tip is if this isn't getting better, try get it assessed as soon as possible. And the reason for this is because plantar fasciitis, even though we call it itis, it's not what we would describe as a true sort of inflammatory problem. So you might get some inflammation in the early stages, but what we often see is actual changes to the cell structures if we were to ultrasound it. So you might notice some little micro tears in there. You might notice that some of the collagen is thicker. And you actually get the structure of the tissue changing, and this can influence how we then manage it going forward. It's not just a case of you just need to rest it for long enough and then it will get better, especially if it's debilitating enough to affect your walking, your sleep, and obviously the activities you want to do, such as running. So get it assessed, because as well, it might not be plantar fasciitis. So we often describe this heel pain, bottom of foot arch pain as plantar fasciitis, but it could be that you actually have something else going on. So you might have a reduction in the fat pad of your heel. So this can sometimes happen in your heel. There's a fat pad. Sometimes that can atrophy and get smaller. That can cause heel pain. You may have a bony spur on that heel that every time you put your foot on it, it's causing you pain. You might have a significant tear in that plantar fascia that actually might require a different management to massage and heat. What else could be going on with it? You might have a nerve that's trapped. It might actually nothing to do with the fascia in terms of its actual structure. It could be a nerve problem. And there are other things as well, which it could be linked to systemic problems. So if you have other sort of medical conditions going on, which you would chat through with your healthcare professional, it could be that you need referring back to your GP and having some blood tests to just check that there's nothing else going on and it's presenting with this plantar fasciitis type pain. So when you go and see someone, who are you going to go see? You'll see a physio probably, or you'll see a podiatrist. A podiatrist specialised in lower limb problems. Go and see someone who works with runners. Try and get a sport specific type of therapist. I would recommend that because I think you'll get the best type of management. In terms of treatment, they will often look at biomechanics of the foot, because this can create different stresses and pressures on that plantar fascia. They will look at the strength of the calf complex and the flexibility. So you might get some orthotics, you might get some stretching and strengthening exercises. We might try some sort of symptomatic relief like massage and tape and maybe heat or ice, but these are just things to kind of like ease the symptoms really, while we're doing the other stuff that might change the structure of the tissues. If none of that is working, if you are not getting any symptom relief with the conservative management, there are other things you can try. So there's shockwave treatment. Sometimes people have injections in it. Very rarely do we need surgery. I've never worked with somebody that's had surgery on their plantar fascia. But do your research in terms of your healthcare professional that you're going to see if you've been having this chronically, so it's been going on for a long time, to make sure that they are going to be able to provide the best care for you. Alternatively, you can always go for a second opinion. You could go for a physio's opinion and a podiatrist's opinion, get them professionals to work together to help create the best management plan for you. I think that's all I wanted to say on plantar fasciitis. I think we've covered through most things there, but I think the thing is that it can be very debilitating. If it's been going on for a really long time, you don't have to wait 12 months before you have any other treatment by the conservative management. I think if you've been trying conservative for, at least 3 months and it's not really helping, maybe even less than that, depending on how debilitating it is, you probably want it imaged, at least ultrasound, and you probably want to start thinking about some alternative options if nothing's working for you. I hope you found that helpful. Very whistle-top tour on plantar fasciitis there. It's a multifactorial problem. There's lots of things that can be going on there. Get it diagnosed as a plantar fasciitis first. That is the key thing. And then you can work through those management strategies. I hope you found that helpful. Any questions, pop a comment below. Other than that, guys, happy running.